Hi, my name's Lisa. I'm an OT and Clinical Excellence Lead here at KEO Care. I've been working in the paediatric space for 14 years now, kicking off within school environments, across clinics, and now within the community space. I'm here to chat about the cognitive orientation to daily occupational performance, otherwise known as the COLP approach. As OTs, we often support participants to achieve everyday tasks, but sometimes the biggest challenge isn't always the task itself, it's knowing how to approach it. So today we're going to look into the COLP approach and support understanding its strategies and how it can best support participants to reach their goals. Difficulty can sometimes lie in planning, problem solving, or sequencing steps, not just the task itself. OTs can help build individuals to develop strategies, break tasks into manageable steps, and really build confidence to complete tasks independently. The focus is learning to think through the task and not just doing them. So approaches such as COLP are cognitive-based framework, and they really focus on planning, doing, and checking, rather than the therapist just demonstrating or correcting that participant. The aim here is to empower individuals through discovery, helping them learn strategies and problem-solving skills rather than giving them the direct instructions. What is the COLP approach? The COLP approach is really participant-centered and it's cognitive strategy-based, so it's there to support guided discovery and empower participants to navigate how they're going to problem solve rather than the therapist giving direct instruction. It really uses client-centered OT models, so it really supports the client to develop their own goal that they would like to work on, and then it uses cognitive strategies to achieve their daily tasks. The approach emphasizes learning, problem solving, and acquiring skill. It uses guided discovery and motor learning principles to support that development. Participants will set goals following a plan, do, check process. They'll develop transferable strategies for independence, and really the therapist facilitates rather than prescribing solutions to participants or families. The great thing about it as well is it's really applicable across a variety of conditions and diverse settings. Key concepts of the approach is that the participant chooses their goals, so it really supports person-centered approach and a family-centered approach to work with that participant or child in the goal that they find really meaningful and that they want to achieve. The therapist really is there more as a facilitator to guide that person, and they learn transferable strategies across different environments for different conditions. We'll look at the evidence and why it matters surrounding the COLP approach. So originally it was an approach that was developed for a condition called developmental coordination disorder, otherwise known as DCD. And over the years, it's now supported across multiple diagnoses. So participants living with an ABI, autism, ADHD, cerebral palsy, stroke, and many others. The outcomes really do benefit way beyond task success, and we do see greater participation for participants in session. We see improved regulation, and we see improved self-efficacy with a lot of the participants that this approach is applied with. COLP really is one of the most extensively researched frameworks in rehabilitation, as it does use cognitive-based strategies to support task completion and achievement in goals that have been designed by the participant. COLP in action. So COLP uses a framework called Goal, Plan, Do, Check. It's a 4-step framework that unpacks exactly what the plan is going to be, the participant setting out their goal, how they are going to execute it, completing the task, and then reviewing and monitoring how it went. We emphasize some core objectives when using the COLP approach. So the first one is skill acquisition. This is around really supporting participants to learn and master their targeted functional tasks. So we're really supporting them to acquire the skill that they've set out to achieve. Generalization of skills. This looks at enabling the application of the learnt strategy to everyday life activities. So being able to generalize that skill across environments. Cognitive strategy use, where we look at encouraging the development of problem-solving techniques and self-monitoring skills for the participant, and then really guiding that transfer of learning. So promoting the ability to apply learned strategies to novel tasks and different environments as well. So how does COLP support daily life skills? It really supports by enhancing an understanding of task requirements. So for participants, they get a really good understanding of sequencing and understanding what is required of them within an activity. It is known to improve memory and ability to recall steps within an activity. We notice greater attention, focus, and self-regulation during activities. We also do see increased confidence, motivation and engagement in everyday tasks. And of course, development of those transferable skills that is really applicable to a broad range of tasks and a variety of contexts as well. I'm going to chat through a case study where the co-op approach was applied. So I worked with a young participant where he identified the goal was to be around learning to tie his shoelaces. He was just about to start AusKick in the following year and had just received a new pair of footy boots. So his goal was to learn how to tie his football boots in preparation for starting AusKick. We used the co-op approach to support achievement of that goal, and how we did that was really unpacking the breakdown and looking at the performance breakdown that happened. So we did what we call a dynamic performance analysis, which really looked at what the breakdown was, possible strategies, and then we used guided discovery and enabling principles through co-op to support him with that. So as an example, one of the performance breakdown that we looked at was around his posture when engaging in tying his shoelaces, and the motor planning that was associated with that. So we really worked to support him to be able to reach his shoes so that his posture and motor planning was much more achievable and not as challenging. We used different colour laces with his shoes to create more of a visual effect, and written instructions to really support that sequencing task as well. Through guided discovery, I asked questions throughout the process to support his learning, such as how do you know which lace goes under the other, or does this look like a knot to you? How does this look? And then we utilised enabling principles, so really to support, will this generalise? So we used a range of shoes to really support his understanding and motor planning of the task as well. Identifying performance breakdowns can look at providing verbal prompts to support identification of what that breakdown could be. It can be to support the motivation of that participant in the task, supporting sequencing to the next step, and really looking at environmental factors that may be impacting that person in achieving that skill. Through guided discovery, I supported the participant to develop the skills around learning to tie a knot. Some of those strategies and enabling principles looked at ask, don't tell. So they were around prompting the participant to be, how could we hold the laces? What does a knot look like? Another principle was coach, don't adjust. So it really supported in asking the participant questions rather than getting in there and trying to correct things straight away. We also used naming the strategy, where he was saying a cross under pull when tying the laces, and I would support by saying, I like how you use the words to help you remember the steps and sequence them to tie a knot. The outcome of utilising co-op with that participant led to his improved understanding of the task, his ability to sequence steps of that activity, remembering steps of the task and referring back to strategies rather than the plan. So we utilised the goal plan do check checklist, but he was going back to the strategies that we used, which was really fantastic. And finally, improved attention and regulation throughout that whole activity. So it was notable that he was really calm and engaged and didn't get too stressed or flustered if things didn't go the way as planned. I encourage clinicians to reflect on how they might integrate aspects of the co-op framework into current caseloads. So co-op helps individuals to really build the skills that they need to support and problem solve through challenges beyond therapy rooms. So supporting participation in the things that matter most to them.